Hello, my name is Allison Warner, and I am the Chief Editor of Orthodontic Products. Thank you for joining us for today's podcast episode of In the Sterilization Room with Jackie, where we talk to infection prevention expert Jackie Dorse about what you need to know to keep the orthodontic team and patients safe during the COVID-19 pandemic and beyond. For over 30 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She has degrees in microbiology and dental hygiene, has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Hi, Jackie. How are you doing?
Very good, Allison, and thank you for hosting in the sterilization room with Jackie. It's as we get into over 25 months of the pandemic, there
hmm
is always new information and new things to talk about. And the big event that we have coming up this in May next month is the AAO's annual session in Miami Beach.
Yeah, exactly. And so that's where we're going to focus in on today because, the exhibit hall offers a great opportunity for attendees to see the latest products up close and try them out. And they haven't had that for the last 2 years. So I'm sure everybody is kind of chomping at the bit to check out what is going to be on offer. And so I know we wanted to talk specifically about what attendees should be looking for when it comes to PPE, instruments, and the sterilization room. So, Jackie, let's get started. When it comes to PPE, in the last 2 years, it's been more important than ever, and practices are still, though, practices still aren't quite happy with what they've got. So I know you recommend that they take advantage of the exhibit hall and the ability to try things out and to get samples. So what should attendees be on the lookout for at the AAO this year?
Well, the PPE, especially during the pandemic, we've learned more about mask and respiratory protection and shields and safety glasses. We've
hmm
all worn procedure masks, but it's those N95 respirators that have been a real challenge for everybody to wear. And some of the ones that were available at the beginning of the pandemic, and orthodontic team members, the doctor and the assistants, had never worn N95 respirators prior to the pandemic, and they found out that the ones that were available were, if they could buy them with the shortage, rubbed their noses and actually caused sore places. And they fit
hmm
so tight that they were getting a rash around their face. And during the pandemic, there have been a lot of new products that have been introduced, including new N95 respirators, new design, softer materials, special cushionings with them, both for added comfort, for breathability, and a better fit. There
Mm,
are even some extra small N95 respirators that are now available for people who have real slender, petite faces. So
okay.
lots of improvements. If they tried an N95 respirator in 2020 and they haven't tried again, I would highly recommend getting samples on the exhibit floor and trying on the different ones that are there, because as we get through the pandemic, infections are declining. We have vaccines, there are great treatments now. The emphasis is not as much on airborne diseases, but OSHA, with their respiratory protection standard, will continue to issue guidance on how to protect workers from airborne diseases. And I know in my seminars and webinars, I actually have a slide that lists 16 diseases that can be transmitted in the air. So I think
Mm,
finding that comfortable N95 respirator that everyone knows how to put on and is they will wear. If it's not comfortable, you won't wear it. There isn't compliance with it. And then you provide the training, and will that respirator pass a fit test? Many of us have
yeah.
heard, hey, you're supposed to do a fit test. That's what OSHA requires. But in reality, many offices have not conducted fit tests.
Yeah.
And one of the things that I was excited about in the past couple of weeks was that I learned that one of the instrument manufacturers, Hugh Freedy, is actually selling a fit test now. It's an N95 fit test. It sells for about $275, and you don't have to have a certified or a trained person to do a fit test. You can watch the videos, learn how to do your own fit test, and with this kit, provide the fit test that you need for everyone in your office. The only additional thing that would be required is that each employee needs to do the OSHA medical evaluation, and that needs to be reviewed by a nurse or a physician. that there are no physiological reasons that the employee should not
Mm,
be wearing an N95 respirator. But
okay.
that can be easily reviewed. The employee fills out the questionnaire, and then it's reviewed by that healthcare professional, and you do your own fit test in the office. And that's such a convenience because you may have to change brands of N95 respirators. And if you change brands, then you have to do a fit test again to verify. So I've been real excited about showing audiences and live seminar attendees, now that we're resuming live meetings, how to use that fit test. And so looking at the N95 respirators that are available and gloves. Oh my gosh, there's been a price
Mm,
increase in gloves, a shortage increase in
mhm,
gloves. And when I attended the OSAP boot camp, Darby, one of our suppliers for orthodontic products, they featured in their new product description some nitrile gloves that you can put on and that easily slide onto your hands, even when your hands are wet. Now, what
mm,
happens when you wash your hands with soap and water and you dry them off with a paper towel? If you don't get them absolutely dry and you're trying to put on an exam glove, it sticks, it won't get on, it will tear on you. But these gloves slide on like silk. So they'll have those in the booth there. You can try them out. And I'm anxious to try on a pair on the exhibit floor. And then another thing I would, under PPE, is highly recommend that offices look at Cure Light shields. Find a Cure Light shield or Cure Light safety glasses that are the match the wavelength of your Cure Light. Because remember, we have that great eye safety video
mhm.
with
Right.
our In the Sterilization Room series that Dr. Marie Fluent talked about potential damage to the eyes when we're using a Cure Light and not wearing Cure Light
Hmm.
safety glasses. So
Yeah,
many
exactly.
offices, that might be something that they don't have, and it would be good to look at on the exhibit floor.
Yeah,
Yeah.
exactly. Great. Well, I know that, instruments are always number one or very high on the list for orthodontists when they go to the AAO to check out. So we've talked about instrument inventory in previous episodes, but I know that you recommend that before doctors head to the exhibit floor, that they have a plan in place for how they're going to go about their instrument shopping. What do you recommend?
Oh yes, it's easy to get on the exhibit floor, and you know you need some new instruments, and everybody's so happy to be back together and see each other face to face, and the manufacturers have specials. And when
Mm.
you get intrigued with that special, buy six, get one free, and, try this, and you go, oh, well, I know we need some new distal end cutters in the office, but you don't know how many. Or, gee, that the doctor may be standing there on the floor and go, this distal end cutter feels good to me. But who uses that distal end cutter?
Hmm. Hmm.
90% of the time in the practice, it's the orthodontic assistants.
Yeah.
So before the doctor goes, or whoever is going to do the purchasing on the exhibit floor, have a plan, be prepared. Do an audit of all of your instruments in the office and an inventory. Remove instruments, those math files that the tips don't come together anymore, and that's the ones that the assistants keep throwing in the back of the drawer or going, dang, we need to get a new one here.
Yeah.
But which brand, which style? Do the assistants prefer the long, slim handles?
Hmm.
Or do you want those shorter, fat handles? And what, if you have cassettes, which instruments fit in those cassettes?
Right.
So
Exactly.
it's real important to create a master list of the manufacturer's name and the number of that instrument that the orthodontic assistants prefer. So
Mm.
you have that master list. Then it's easy to go back and look at the inventory. How many Weingarts, how many ligature cutters, how many distal end cutters do you have? And then I'd say look at your schedule too. If you're
Mm.
seeing more aligner patients now than you did in 2019, then it's time to adjust your inventory of instruments. You may need some more of those aligner instruments where you're going to put
Mm.
a dimple in or punch a hole or do some changes. And maybe you need two of those for every patient chair if you're
Right.
over 50% aligner patients now. So making that determination before going to the AAO and knowing the number of those instruments you need and what is the preferred instrument by the orthodontic team is very important to making smart purchase decisions and taking advantage of those specials that the manufacturer will offer at the AAO. So another thing that I'm going to put out there as a consideration
Hmm.
is for offices to ask the manufacturer of the instruments, are your instruments guaranteed for steam sterilization or
Ah, okay.
sterilizing in an autoclave?
Okay.
And to look at the warranty. What's the warranty on that?
Mm,
Does the company provide free maintenance on it, sharpening for
hmm.
those instruments, or is there a cost with it? Knowing that up front, because I have many offices recently that have been calling me that have had dry heat sterilizers that are now having to look at changing to an
Wow.
autoclave.
Okay. Okay. Well, on that front with the sterilization room, um, what should orthodontic practices have on their shopping list? What do you think they should be on the lookout for? Because you did mention that dry heat is those
That's
that system
right.
is, yeah.
One of the most popular dry heat sterilizers that orthodontists have used for years is the Dentronics DDS 5000 sterilizer, and the
Hmm.
manufacturer has discontinued it.
Hmm.
It is no longer sold, and now parts are no longer available to repair it. So
Mm, okay.
that's what I've been getting a lot of calls about
Okay.
is now doctors are realizing, hey, we need, our dry heat sterilizer died. That's usually
Hmm.
the first statement.
Yeah.
Jackie, our dry heat sterilizer died. What do you recommend? And looking at autoclaves, there are different types of autoclaves that are available. There's a gravity sterilizer. That's the traditional older design where it creates the steam, has the sterilization cycle, and then at the end of that cycle, the door pops open, the residual steam is released into the air, and then there's another 20 minutes added to the cycle for those instrument packages, the pouches or the wrapped cassettes, to dry inside of there. And it doesn't always completely dry those instruments, and it's a long cycle with it. The other
Okay.
type of sterilizer is what is called a pulse type sterilizer, and that injects steam into the chamber. So many orthodontic offices invested in a pulse sterilizer, such as a Statum, to sterilize
Hmm.
their handpieces because
Okay.
it is a shorter cycle time. However, with the CDC standards that all instruments should be wrapped before sterilization, sterilized, and remain wrapped until used with the patient, the Statum it doesn't dry quite as well. You
Mm,
have to do several things to ensure the drying of it. And
okay.
there is a newer type, more recently approved by the FDA,
Mhm.
sterilizer that is a dynamic air removal sterilizer.
Okay.
Now, by dynamic, it means it has a vacuum pump that pulls the steam into the chamber to speed up the cycle and get that penetration throughout the chamber. And at the end of the cycle, that vacuum pump or dynamic air removal removes the steam from the chamber and
Mm,
reduces the drying time.
okay.
It reduces the overall cycle time versus a gravity sterilizer about 40%. So we're
Mm,
seeing 35, 40 minutes for from start to finish for dry packaged instruments. So I'd highly recommend that they look at this on the exhibit floor. I know I talked to one company. Normally, we don't see a lot of sterilizers at the
mhm.
AAO.
Oh,
The
okay.
exhibitors don't bring. It's a big, heavy piece of equipment, 150
Yeah,
pounds, and
true.
they need electrical setup or something if they're going to set it
Mhm.
up. However, I did talk with Hugh Freedy at the Chicago Midwinter, and they are going to have an actual sterilization center
Oh,
at
okay.
the exhibit. So it will show you the cabinetry that will move from dirty to clean to sterile, what's the
Mm,
correct setup with it. And they will
mhm.
have some equipment there, and you could actually have the cassettes, maybe lay your instruments in the cassettes and see
Yeah.
how those cassettes load into the
Ah, okay.
sterilizer.
Okay.
And there will be other equipment manufacturers there.
Mm,
Boyd manufactures an excellent sterilization center,
mm,
and they will have their sterilization center there on the exhibit floor. So that would be another good place to look. And they usually will have maybe a stack clave and
mhm.
maybe an instrument washer and an ultrasonic that will be there.
Okay.
And I'm going to go down an extra little recommendation
Uh-huh.
for a product that I saw at the Chicago Midwinter. There's an ultrasonic manufacturer named
Mhm.
iSonic, just like
Okay.
your iPhone or your iPad. This is iSonic. And
Okay.
iSonic is a ultrasonic manufacturer that has a great small ultrasonic. It's almost like a personal use. Well, it is a personal use. You can keep it on your bathroom counter at home, and it is fabulous for cleaning those stinky aligners that, oh my gosh, when you're wearing them all day and all night, you take them out and you try to brush them to get them clean, but there
Yeah.
can still be odor with them. And of course, there are special aligner cleaners, but there is nothing like using an ultrasonic that implodes the bubbles and pulls all of the debris off of whether it's a retainer or an aligner with it. So I'd highly recommend that you go by the iSonic booth and look at these. They're economical, cost under $100, and it might even be something that orthodontic offices would look at offering their patients.
Mm.
And definitely anybody who's wearing aligners or retainers will want one of these if they know about infection control and preventing disease transmission and getting their aligners clean.
Yeah, no, exactly. Is there anything else you're looking forward to in the exhibit hall?
Um, for innovative products, all of them, and socializing and learning from the different manufacturers. You know,
Yeah.
we've missed sharing information. Just, I always learn. I was recently at the Chicago Midwinter,
Hmm.
and there was so much that I did learn from spending time with the manufacturers and learning about the new products. I would highly recommend that doctors look at handpieces
Mm.
that we all need those handpieces, and being short of handpieces is a real challenge.
Yeah.
When and it, just because we are transitioning more to a liner treatment doesn't mean that we're not going to be using as many handpieces to remove cement
Hmm.
after we do a debond, because there's still
Yeah.
all those buttons that we're
Hmm.
using with a liner treatment.
Yeah,
So I would say
exactly.
handpieces would be another top priority.
Okay. Well, Jackie, before we go, I know that you are going to be speaking at the AAO on Tuesday at 8 a.m. What will
Yes.
you be talking about?
Infection control and OSHA. What's
Mhm.
changed? What's new? What we need to know going forward from this pandemic. And we are seeing the pandemic. I'm not going to say it's over. We
Mhm.
are getting to a manageable stage now
Mhm.
with this airborne disease. We know from both OSHA and CDC guidance what's effective in our offices,
Mhm.
installing that MERV 13 filter and looking at the HVAC system for
Right.
removing airborne diseases, and even our high volume evacuation. So I'll talk about the specifics and what OSHA is going to look at with their new permanent standard
Mm.
after the emergency temporary standard expires with it,
Right.
and CDC's latest guidance. So I'll be updating the team on what we need going forward, because
Mhm.
there are all those other airborne diseases that we're going to need to protect ourselves and our patients from, even
Yeah.
post pandemic.
Yeah, exactly. Well, thank you, Jackie, so much. And I look forward to actually, I'll get to see you too in Miami Beach. And for our listeners, we look forward to hopefully seeing you there as well. And to check back on, or sorry, check back soon for the next episode of In the Sterilization Room with Jackie. And in the meantime, to catch up with past episodes or to check out the latest orthodontic industry news, visit our website at orthodonticproductsonline.com. Until next time, take care and stay safe.